Goni Thoracic and Lumbar lateral flexion. Position the patient in standing with the cervical, thoracic, and lumbar spine in 0 degrees of flexion, extension, and rotation. In patient-appropriate language, ask the patient to laterally flex as far as possible while keeping the arms in a relaxed position at the sides of the body. Make sure the patient keeps both feet flat on the floor and the knees extended. Palpate the pelvis for lateral tilting. Passive movement is generally not assessed due to the difficulty in moving the patient through full range of motion of spine. The end of lumbar lateral flexion range of motion occurs when resistance to additional movement causes the heel on the opposite side being tested to rise and the pelvis begins to tilt laterally. The normal end feel of the joint is firm because of tension in the contralateral fibers of the annulus, facet joint capsules, intertransverse ligaments, thoracolumbar fascia, and the various other muscles. Refer to your text for a complete list. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Use a skin marking pencil to mark the spinous processes of C7 and S1. Align the axis over the posterior aspect of the S1 spinous process. Align the stationary arm so that it is perpendicular to the ground. Align the movable arm with the posterior aspect of the spinous process of C7. Ask the patient to perform lateral trunk flexion as done previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movement of the pelvis. Read the degrees of motion on the goniometer and then ask the patient to return the trunk to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion according to the American Association of Orthopedic Surgeons is 35 degrees.